imagine a future and a workplace where a healthy work environment is our top initiative, our golden moment, the thing we really wish to achieve, and creating cultures of joy, a place where we want to be, where we want to help our students learn.
What if civility wasn't optional, but embedded in every nursing curriculum? Today, we'll discover how education can shape more compassionate, resilient teams. Welcome to the Lippincott Spark, Illuminating Nursing Education podcast. I'm Dr. Kelly Drees. Join us as we ignite your passion for nursing education and leadership. We'll explore the latest trends, hear from expert nurses, and provide tools to keep you inspired. Let's dive into today's episode and continue your professional development journey together. Incivility in nursing education isn't new, but it remains a pressing issue. Despite decades of research, both students and faculty continue to experience and report uncivil behaviors. And it's not one-sided. Faculty see it from students and students see it from faculty. In this episode, we'll explore how cultivating respectful, psychologically safe environments can strengthen teams, elevate outcomes, and reinforce the compassionate core of nursing. We're joined by Dr. Cynthia Clark, founder of Civility Matters and professor emeritus at Boise State University. Dr. Clark is a nationally and internationally recognized scholar whose pioneering work in civility has transformed how we think about healthy, academic, and clinical environments. She's a passionate advocate for building cultures of kindness, respect, and connection, starting with how we lead. Welcome, Dr. Clark.
Thank you again, and to our listeners for joining us.
Let's begin by exploring the foundation of today's discussion. You know, one of your most influential contributions is the pathway for fostering organizational civility. Can you take a little bit of time and describe the pathway and explain how institutions can effectively implement it to kind of foster and maintain a healthy workplace culture?
Thank you for the question. So before I dig into the pathway, I have to do a great shout out to my former undergraduate research assistant. His name is Dan Wynn, and Dan is now currently a practicing nurse. But way back when he was my undergrad research assistant, we worked together for, I think it was 3 years, from like 2010 to 2012, 13, somewhere in there. And the reason I want to give him a shout out is because I remember sitting in our office dreaming about what would it be like if we were to create a structure, a framework, a change theory, if you will, on how to transform work environments. So it takes me back to those days. And since then, the pathway has been used in numerous academic and healthcare institutions. So as we know, many academic institutions, and as you said in your opening remarks, not only academic institutions, but practice environments, we're really trying to shift the culture from one of incivility to being respectful, collaborative, and so forth. And so the pathway for fostering organizational civility offers a step-by-step, evidence-based framework to transform the work cultures. Now, I recognize that when we're trying to create change or transform cultures, there's absolutely no way that can be linear, right? Because it's messy, it's complicated. Yet I offer this as an 8-step process in order for us to understand how we can transform our cultures. So, would you like me to take you briefly through those 8 steps?
Sure. How would that look in particularly academia?
So the very first step is that we need to get leadership on board. We need to enlist their support. I know that we've talked about leadership. We'll talk about it again more today, but it's so absolutely incredibly important. And while I understand that all of us are leaders to some extent in all of our capacities as nurses, I'm really talking here about the executive level of leadership, I'm talking about our deans, our directors, our VPs, our provosts, our chancellors, and so forth, really recognizing that creating a healthy work environment institution wide is absolutely essential. Not only do the leaders have a wider span of influence and maybe a broader view of workplace issues, but they can also provide the resources we're going to need to do that heavy lift sometimes of transforming the culture. And so having them on board is absolutely pivotal to being able to transform the culture. The second step has to do with assessment. And I know that in our world of academe, we have campus culture surveys and things like this, but I'm really talking about getting much more granular within our departments of nursing or schools of nursing to really understand as we assess that work culture of how we communicate or maybe don't communicate, how we resolve conflicts or don't resolve conflicts, and so, really doing a careful and empirical assessment. The third is, and I think is absolutely critical and has made the difference in so many academic institutions where the pathway has been implemented, and that is we need to have a team whose purpose is essentially twofold. We want a very trusted, committed, empowered group of members who represent a lot of diversity of thought, position, discipline, and so forth. They're not going to do all the work, but they have two major purposes. One is to support and advance the mission one of creating a healthy work environment. And the second overarching purpose is really to oversee the implementation of a data driven action plan. And so step 4 is just that. We've collected this data. Maybe we've done it through focus groups or empirical surveys, any number of ways, and we fashion that into a plan of priorities. 5 is to implement that plan. Step 6 is to evaluate the plan. And then the seventh step is as we've done all of that, and it's a lot of work, but now we begin to embed civility into our culture. And often that's done through comprehensive policies. And then lastly, and I know I'm being really brief with these, but the last step that's threaded throughout is to consolidate gains and celebrate, the big wins, the small wins, celebrating achievements. And that can be done without a lot of money. There's so many other ways that we can celebrate our, accomplishments and achievements without breaking the bank. So that's it in a nutshell. It's much more in depth and lots of detail, but that's kind of an overview of the pathway.
I think about the role of education and faculty development and whatnot. How do you think that would play into this as far as being able to design a faculty development program to really support educators modeling and teaching civility, and especially in these high stress academic environments? So if they're following this pathway, how do we support them in doing this work?
It's an extraordinarily great question, and there's going to need to be a lot of support. One of the things I mentioned, of course, are the resources that faculty will need and actually staff, because the most efficient and most excellent teams that have been formulated within the pathway and moving toward a healthy work environment has an array of disciplines, staff, faculty, eventually bringing students into that conversation and having them be part of the solution. I talked about the role of leadership in terms of that being the first step. They're going to be providing the kinds of resources that folks are going to need: human resources, technology, time to do the work, maybe modifying workload and other kinds of responsibilities so that faculty can dedicate themselves to this effort and staff. But when we think about, but going back to your question here a moment ago, related to faculty development and how can we support faculty, And I think one of the major areas to start is raising awareness. What I often call a comprehensive civility education initiative. And those can't be one and dones, right? They need to be part of faculty development that is continued over time and is ongoing, that's using research based evidence, case studies. In part one, we talked about cognitive rehearsal. In my mind, if you're not doing it and only talking about it, it's not going to be all that useful. So I think we have to get up and move and work through that, debrief it. So those are skill building workshops I'm talking about. One of the areas that's sadly lacking, and you have probably noticed this in your own work and our listeners as well, we have deficits around comprehensive mentoring programs throughout not only academic institutions, but in our practice based clinical areas as well. I think much has been learned, particularly post pandemic, about how essential it is that institutions provide resources for self care, for stress management. So, those are a few. There's certainly so many others. And I'll just mention one more because I think it's so important, and that is creating a community of support. A place where we can go that's a safe space for us to share, what's going well, what's not going so well, and getting support from colleagues.
So very important. I've talked to many leaders, deans, directors, as you said, provosts, etc., that they may inherit this environment and they're charged with creating a safe environment and that culture of civility. And you shared looking at the faculty workload and developing faculty development programs and strong onboarding to really talk about that culture of civility. And how can the embedding of civility and respect across the nursing curriculum help build a stronger and more compassionate nurses and teams? Because obviously the students are watching. The students are watching the faculty, how we conduct ourselves, how we treat each other. And then it ripples, right into practice. And then, of course, we talked on part one a little bit about how that affects patient care as well. So, are there any other examples or real world experiences that you've had where you've seen a school of nursing use this pathway and create a positive culture?
One comes to mind right at top of mind because that school of nursing was awarded the very prestigious Sigma Theta Tau Healthy Work Environment Award for academic settings. That one, again, is top of mind because we are currently writing an article demonstrating specifically how the pathway has been utilized to transform the workplace. What's really cool is that you remember in step two that assessing the culture is so incredibly important. Let me say this, that when we did the pre assessment of that school of nursing, there were clearly areas that needed to be addressed. And so we identified and prioritized, okay, what are the areas that we want to definitely address over the next, say, semester, academic year, and beyond? Now, we just did the post assessment this spring. The assessment tool that we used has 20 items. It's called the Healthy Work Environment Inventory. This school skyrocketed on all 20 items. In every single item, they scored, in some cases, up to 70 or 80-point increase. And their healthy work environment overall score jumped from unhealthy, because the tool can also give you a readout on the overall healthy work environment. And then we jumped 20 points into the moderately healthy. And I give full credit to not only the Department of Nursing as a whole, but the academic leadership that led that, as well as What their team, remember, step 3 is to have a team in place. Their team is called the Crew Council. Crew stands for civility, respect, engagement, and wellness. And they have a dedicated team who's overseeing that data-driven action plan and making huge strides. It's phenomenal what they've done. So that's just one example, though there are several others. But that one is just so striking because they're an award-winning school of nursing.
That's fantastic. That's exciting to see. And even with the best tools, we know that change isn't always easy. What challenges have you seen, and maybe common barriers do institutions, face when trying to implement civility initiatives?
Several. One that comes to the top of my mind is sometimes there's going to be a lack of leadership buy-in because there's so much going on and so many other initiatives that need to be tended to. So it might be that the issues that are going on within, say, a school of nursing or a program of nursing is somewhat invisible to the leadership. And so the way we address that then is we need to engage our leaders in conversation to help raise awareness. So going back to that first step, demonstrating what is the impact of incivility on so many areas like student retention, ultimately patient safety. We talked about that in part 1. Sometimes there are limited resources, time, money, and things like that. Yet I think there are ways to leverage low cost methods to help improve the workplace. One of the things that I see a lot is people don't know what to do when and if uncivil or unsavory kinds of experiences are happening because there's no roadmap, there's no guideline, there's no policy, there's no procedure. And so that's one of the things I highly recommend is to work institution wide to create policies and procedures that would address these uncivil behaviors. But as importantly, how are we rewarding the kinds of behaviors we want to see?
Yeah, I've seen some faculty experience incivility with the leader. And as we look at trying to get the leader's buy-in and assess the culture and the climate, I see faculty sometimes struggle with what if the leader is exhibiting uncivil behaviors and such, and it can be quite complex trying to navigate that. I'm not sure if you've seen that as well, but that seems to be a challenge.
Here's my belief about that. There are some folks that believe that addressing certain behaviors shouldn't even be attempted. Why bother? The stakes are too high, whatever. I'm of the belief that in many cases, and my work has shown this as well as lots of other people's work, is that sometimes we don't have a clue how we're coming across to other people. There's that lack of an insight, that lack of self awareness, which, by the way, I see as one of the top individual competencies for learning more about ourselves and what we either bring value or a lack of value to the work environment. So I always think that to be well prepared, and again, I sort of go back to cognitive rehearsal, role playing those experiences, practicing, putting yourself in that situation in a role play, and then rehearsing how you're going to address that. Yesterday, you mentioned the idea when we were talking about cognitive rehearsal is thinking about what are some of the evidence based frameworks that we can use, like the PALE method and others, to help us frame the conversation that we're intending to have. So if you and I are colleagues, that's a different experience than if I need to go have a conversation with my dean, right?
Yes, very much
And
so.
so I want to be well prepared. I want to have worked on reducing my stress, hydrating well, being as rested as I can to have that conversation. Now, it's possible it's going to go very well, and that's what we hope, right? We also know that sometimes it's not going to work. If that's the case, it might be helpful to say something like, we didn't achieve the outcomes, at least I was hoping we might today. I wonder if we can get together again for a follow-up conversation. If it doesn't work that second time, I really think it's time then to have a third party whose role it is to make certain that each of us are being allowed to voice our concerns. It's hard stuff. There's no question about it. I absolutely believe it's worth giving it a whirl, even if you start with at the point which you're inviting that third party in.
Absolutely. It can be so challenging. And like you said, if those behaviors are exhibited by that nurse leader, whether they're have lack of integrity or accountability or toxic interpersonal dynamics, I find one of the most challenging behaviors is even absenteeism, where it's what leaders are failing kind of to do sometimes is even more damaging than what they do, right? I find it even more harmful than bullying because they're not being attentive and supportive. So, yeah,
Yeah,
absolutely.
you're reminding me of when I was in my early clinical years, so my background is psych mental health, specializing in adolescents, particularly adolescents with various issues around anger, violence, and so forth. And I remember a lesson I learned very early on from a very gifted and talented child and adolescent psychiatrist. And she said to us once in our team, you know, bring me an angry adolescent any day. Because when we begin to see that anger leave and enter that area of apathy, it's far more challenging. And that's what you're describing. You said a bullying behavior. Well, that's angry, right? That's maybe even volatile sometimes. But to leave, to be absent, takes us on that continuum to apathetic. And those are more challenging situations. One thing I'd like to offer, and it goes back to the second step of the pathway, is if we are truly assessing the work culture, those things are going to come out, especially, and we know that best practices around assessing work culture is not only to have like survey data, so say quantitative data, like I mentioned a little bit ago, but what was also in that, what I included in that assessment with that particular school we just talked about, our narrative, fill in the blank, opportunities for people to weigh in with their own perceptions of what's going on in the workplace. Often, when I have done that, leadership does rise to the top in some cases. I should say, lack of, or ineffective, or absentee leaders. So, I think if we do our due diligence to really assess that culture in an effective way, we're going to learn a lot about what's going on. One more thing I want to say about that, I highly encourage that if groups out there are thinking, well, we want to assess our workplace, that's awesome. But I highly recommend that it not be someone within the program. So, most colleges and universities have what's called an institutional assessment team, so they're not in the thick of it, right? They're coming in. Sometimes people will hire, say, a consultant to do it. I think it's very, very, very challenging to do it within your own school. 100 years ago, when I was in my doctoral program, my PhD program, I remember one of my professors saying, "Don't fish off your own dock." And it's always stuck with me. And having done so many of these assessments for other schools and institutions, I always think, "Oh, man, I'm really glad somebody within the school isn't reading some of these narratives because some can be pretty scathing." And as a consultant, I can redact a lot of that, and it's never, ever shared only in large themes.
I had done an assessment of the culture of the faculty that I worked with, and it was very interesting because kind of a random topic is how challenging tenured faculty or those who are within a union per se, and it comes down to that academic freedom as well. So it gives faculty bounds of professionalism and institutional guidelines and really the right to conduct research and teach as they choose. But with that is also responsibility and needing to respect colleagues and students. And I think of tenure is designated to protect academic freedom, not bad behavior, not hiding under the cloak of, well, I'm part of a union or I'm tenured. I can behave how I want to behave. They're still expected to treat people with respect.
And that's where I think often, not in every case, of course, but our practice colleagues have a leg up because they're not locked into a tenured system. Most of them are being evaluated in a 360. It's just a very different environment as to how we are evaluated. I'm with you. There are some certain protections that I think we need to sort of evaluate in terms of how we're assessing our own behaviors and our colleagues' behaviors.
Do you have any metrics or indicators that organizations can use to kind of assess the effectiveness of their civility initiatives? Because you said part of the pathway is to evaluate and assess. Just curious about that.
You betcha. So there are several ways that you can measure it. A couple come to mind because I use them all the time. And there are tools that I've created. One is called the Workplace Incivility Civility Survey, where it's assessing multiple elements of the work environment. The other one is the Healthy Work Environment Inventory. I love that one a lot because it's short, it's only 20 items, but there are others as well. So I would highly recommend that you use empirical, valid, and reliable tools. But again, not stop there because you want to also be collecting narratives and asking people key questions. You can also look at some of the indicators we have in our colleges and universities. What is our retention and turnover rate of faculty and staff? And you mentioned earlier absenteeism. What is that looking like? What are sick leave patterns looking like? Those can be interesting metrics. And the evaluations, though, I'm not always certain we are evaluating along the correct criteria or indicators, especially when it comes to students evaluating faculty. I think there's a lot to be learned, but sometimes evaluation data can help with that as well. I see myself as a mixed methodologist, but I'm a lover of stories. So collecting those qualitative comments from people through focus groups, sitting down and having interviews one to one. And then one of my personal favorites is having an anonymous suggestion or idea box, where people can either do that digitally online or physically, a real life box.
As we wrap up, Dr. Clark, we'd love for you to share one final spark, maybe a pearl of wisdom or a standout insight or inspirational message to uplift and energize our listeners. Do you have a spark for us today?
Sure. When I think about that, I just want our listeners, as long as they're not driving, maybe just kind of close their eyes for a moment and imagine a future in a workplace where a healthy work environment is our top initiative, our golden moment, the thing we really wish to achieve, and creating cultures of joy, a place where we want to be, where we want to help our students learn, a place of renown, where all of us can thrive and innovate and flourish and really create lasting change. I believe if we imagine it and we dream it collectively, we can make it happen. So I want to thank you so much for
Yeah.
being part of the Spark podcast.
Thank you so much. I love to hear your powerful insights and your strategies for cultivating civility. And as we've learned today, fostering a culture of respect isn't just nice to have, but it's a professional imperative. And, for our listeners, If this conversation sparked ideas or inspiration, we encourage you to take action. Start that dialogue with your team, explore the pathway for fostering organizational civility, and commit to being a catalyst for change in your own environment. And hopefully together, we will build a more civil, compassionate, and connected future for nursing. Thanks again, Dr. Clark.
Yes, thank you.
Thank you for joining the Lippincott Spark, Illuminating Nursing Education podcast. Enjoy this episode, subscribe, share, and leave us a 5-star review. For more information, click on the link below to learn more about Lippincott Nursing products and services. Until next time, keep leading, learning, and making a difference in nursing education.